Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
We're now number 1 in the country in per capita testing.
Louisiana steps up the testing process, exposing larger infection rates.
How many and for how much longer?
The COVID-19 crisis through the eyes of a nurse in New Orleans.
It's almost like you're grieving alone.
Nearly empty churches at funerals because of COVID-19.
It's important to keep your normal rhythms and routines.
A pastor on why our spiritual life is a big part of that.
Hello, everyone. I'm Natasha Williams.
And I'm Andre Morrow. Much more on those top stories in a moment on this week's edition of SWI. But first, take a look at this.
This is St. John's United Methodist Church in Baton Rouge. Each wooden cross represents a Louisiana life lost because of COVID-19.
Look at all those. Now we'll look at other headlines around the state.
Data released this week shows the people in Louisiana most likely to die from the coronavirus. 70% are black. 2/3 have high blood pressure. Because the state is deemed among the nation's most unhealthy, the risk of dying from COVID-19 here is among the highest in America. St. John the Baptist Parish has the highest COVID-19 death rate of any parish or county in the country, with a population over 5,000. Governor Edwards says the state's racial disparity is disturbing and wants to dig into what can be done to change that trend. In a week when the pandemic claimed a newborn baby in the state, models show hospital admissions and death rates are slowing because of people staying home and away from others. The governor is hopeful it is the beginning of the flattening of the curve where coronavirus rates have spiked for weeks. The governor warns the glimmer of optimism does not mean people should relax or leave home and gather. As food insecurity rises in the state, Second Harvest Food Bank in New Orleans received a gift of shrimp, 2,500 pounds, to help families in need during this pandemic. Lieutenant Governor Billy Nungesser and the State Seafood Promotion and Marketing Board announced the donation from the Blue Water Shrimp Company based in Dulac near Houma in Terrebonne Parish. The governor signed a number of proclamations this week, including one related to the State Workforce Commission and unemployment. The state is working to take care of the influx of unemployment claims and many related issues because of the pandemic. This also deals with state health care workers and first responders deemed essential in the coronavirus response. A state educational giant, Ray Odemaw, once recognized as the nation's longest-serving public university president, died this past Sunday after a long illness. He was 91. Odemaw was president at UL Lafayette for 3 decades, from the early 1970s until 2008. The school earned global recognition for computer science, engineering, and Francophone studies, and much more during his tenure.
Governor John Bel Edwards stayed on message this week, and others talked about the alarming statistic we highlighted earlier about racial disparity.
The number of new hospitalizations suggests that we're trending in the right direction, but thus far the number of deaths is higher than we want it to be to have corroboration of that. And so the two most essential data points are not in agreement. Overall, we think we probably are heading in a better direction with a lower trajectory, and that we're starting to flatten the curve, but we can't be sure yet.
As we negotiate this pandemic, our path invariably begs the question, why are blacks being affected in this way? We are your service industry. We're the people driving your trucks to deliver goods, and all that's true. But there's overwhelming data which points us squarely to the social determinants of health.
Senator Bill Cassidy is one leader asking the president to enforce the Defense Production Act so personal protective equipment can be made for our heroes on the front line.
He is also pitching the idea of an immunity registry to document people who've had the virus and no longer at risk so they can get back to work when that time is called for. And also at a town hall event this week in Louisiana, he talks stimulus, the U.S. rethinking business, and that drug we've heard so much about.
Oil and gas is getting a double hit. There's a price war between the Saudis and the Russians right now, and there's some evidence that at least the Russians are dumping their oil on the world market at below their cost of production. And there's also evidence that the Saudis and others have continued to ramp up their output even as our prices have cratered. Now, I consider this a national security issue. What has been clearly exposed is the vulnerability of our supply chains for drugs, personal protective equipment, and other things, because so much of that has been placed in China and in India. So China, for example, makes what are called active pharmaceutical ingredients. This is what we need to make our drugs. They are shipped to China and put inside the capsules, and then it comes to us. China stopped producing them, and so India embargoed shipment of drugs to our country. I'm going to start pushing, and have already, that supply chain be relocated back to the United States. There's different reports about people who are on hydroxychloroquine to treat their other conditions having a lower incidence of coronavirus infection. That suggests that if you're taking it on an ongoing basis, it may give you some protection. I can tell you, Tony Fauci, the head of the NIH, would not accept that as enough evidence to do it. So I'm not recommending that you take it. I'm just reporting the evidence.
He's a nurse in New Orleans, a hotspot for the COVID-19 pandemic. He, like thousands of other nurses around the country, are working extremely long hours directly in harm's way.
36-year-old Bradley Harrison is a dialysis nurse at Ochsner in New Orleans. He says about 3 weeks ago, his work life got turned upside down.
You'd walk in and you'd just look at the board, and it would just be so many names that we were going to have to treat. And it was pretty, I guess overwhelming would probably be the word, for just all of a sudden out of nowhere it went from having a regular patient load to just having so many.
It's his new normal, all a part of the coronavirus effect.
What's the stress level like for an RN like yourself, you and your coworkers? You know, from 1 to 10, what's your stress level?
It's like somewhere in the 8 to 10 range, and I'm pretty hard to stress out. Like, even in like really heavy situations, I'm never really operating higher than a 6, and I'm coming in just looking at the board and stressed out. It's high. I mean, when I first saw that they were saying it could get worse, my thought was, how much worse can it possibly get? We're so incredibly slammed, and I'm starting to wonder what are we going to do when we reach capacity?
And what about when the state reaches the apex? Louisiana is already ranked second in the nation for the number of coronavirus cases per capita.
Do we have enough staff for all of the hospitals and all of the patients that are going to show up? Are there enough nurses to treat all of the sick people?
He admits personal protective equipment, or PPE, is scarce, but they're doing the best they can.
So most of the PPE stuff we're recycling, and it's a lot of stuff that's single use only, but you're having to use it a couple times, and it's because you don't have any other option. We'll just have like the masks, and we'll put them in like little paper bags, and you put your name on the bag. And so instead of taking the mask off and throwing it away, which is what we would used to do, now it's you take the mask off and you put it in a paper bag, and you let that last for as long as you can.
Harrison is at greater risk of getting COVID-19 and can't help but worry a little about what if. 2 nurses in his unit already got it.
We're all young, and so we're in the if you get it, you're gonna be okay demographic. I'm probably the one that's the worst for if you get it, something bad might happen, because I'm a type 1 diabetic. So I've got a pre-existing condition that's on the list of, don't get COVID-19 if you have one of these. Diabetes is on that list.
He has more than 10 years of nursing experience and says he never could have imagined he would ever see times like this.
Immediately after I get I'll get report of, hey, here are the new patients that need to get started on, and then here are all of the patients that, because the COVID-19 makes your blood so thick, their dialysis lines have already gotten clotted, so you're going to have to restart them. And you just look at the list and you think, am I going to be able to get to them all? And am I going to be able to restart all their treatments? Am I going to be able to treat them all? And unfortunately, sometimes, a lot of times, you're not able to get to all of them.
On the day of our interview, Bradley Harrison had worked 12 straight days of a 12-hour shift. Morgues, funeral homes, and cemeteries are bursting at the seams in the Bayou State. Some are struggling to keep up with the staggering death toll from the COVID-19 pandemic. We talked to a funeral home owner in Zachary about how she's handling these very difficult times.
Cynthia Miller has been in the funeral business for more than 40 years, but she says the COVID-19 pandemic has changed the way her family business operates like nothing she's ever seen.
My families are dealing with a lot because I have a family now that I buried their father about 2 months ago, and their mother, 93, bless her heart, she passed away, and the daughter shared with me that she had to drop her mother off at the hospital and just watch them take her in. That was Thursday. She passed away on Sunday.
Miller's client didn't even say goodbye to her mom, and because of new rules put in place because of the coronavirus, barely had time to grieve.
You take your mom to a hospital on a Thursday, you don't expect to get Sunday to get a call that she's passed away in the middle of the night, okay? And then to add insult to injury, we've been mandated to have a funeral in 3 days with 10 people present.
Only 10 people, no matter how big the family, and 3 of those people are usually the pastor and funeral home workers. No visitations, no gathering at the church for repass or family meal after the funeral. She says many families are opting to do a graveside service, hoping to hold memorial services for their loved ones when this is over.
It's difficult because we, as our Black culture, a funeral is a celebration. It's a happening, okay? On an average, my families set a funeral maybe like 10, maybe a week out, sometimes 2 weeks out, because they're trying to get together. They're trying to get everything lined up. People are coming in. So rarely do I have funerals in 3 days. People come over to visit. You hug, you bring food. You remiss because you go back and think about, you pull in all those memories, and all that makes a difference. It helps to the pre-grieving process to start, and you're not able to do that. It's almost like you're grieving alone.
Miller says because of COVID-19 and social distancing, she and her sister are even splitting the responsibilities at their mortuary and limiting contact with the grieving families they are servicing.
So what we've decided to do is she goes in and she does all the arrangements, and I stay home and I do what I do from home on the computer. You have to be careful. People are coming in. We try to do the groundwork, the majority of work before they get in. So when they come in, it's just a matter of them selecting the casket and signing papers. But it still weighs on you because you have to meet with these people. Mm-hmm. Some of these people have cared for their loved ones who may or may not have the virus. So then you have to think about, keeping yourself virus free, right? Over 500 people have died, and here at East Spanish Parish, about 25 people. So those, and he's just repeating the numbers so we'll know. Mm-hmm. But those are number. But when they come into my place, it's not a number. They're real people. Mm-hmm. Real people with real families that love them. Okay? So it's more than a number, it's real people. It's your mother, your child, your sister, people that you love.
The longtime funeral director has a message that she hopes will slow her business down a bit.
That it's affecting 70% of the African American people in Louisiana. Well, part of that is because of those underlying health issues, diabetes, high blood pressure, obesity, heart disease, but some of that also is because we're not distancing ourselves. And you're asymptomatic and you're bringing that home to grandmother or to mama. You don't know because you're fine. Okay. I'm heartbroken because like snowball stands, crawfish stands are open. We don't need this. Those are wants. Okay. Wait until this is over because you're doing stuff that's detrimental. And so when they die, then you're upset. Stay at home.
Miller stresses we can get to the other side of this pandemic if we practice social distancing and stay at home as much as possible. You can't hear that enough.
That's so true. Natasha, thanks for that. While the quest for a vaccine against COVID-19 continues, there's a geneticist in North Louisiana who has discovered something.
A positive way to use a virus, not a coronavirus, to carry gene editing tools into the brain of a mouse. The technique shows promise for deleting the genes in humans that cause autism and schizophrenia. You can view that story and more on lpb.org/the-gene. The segment is part of LPB's production work aligned with the Ken Burns documentary, The Gene and Intimate History. The second and final episodes air this Tuesday at 7.
This pandemic has heightened our awareness of cleaning and keeping the coronavirus away from us. But are we? We found out from Susan Randall. She is a Lafayette nurse with advanced degrees, including a master's in science. She's also a professor at UL Lafayette in their School of Nursing.
One of the things you need to do is for the coronavirus, you need to disinfect. And disinfect means you are getting rid of a large majority of the virus. We can't sterilize it. We can't get rid of everything. But we do need to do all the high-touch surfaces in our homes.
And it's not spray and wipe. It's not spray and wipe like I've done.
It is not. Some people do use the wipes like this. Not all of these are good. It has to say it's a disinfecting wipe. It has to say it kills viruses and bacteria. And it really needs to be on that list from the CDC. This one actually says on the back it's for human coronavirus. So that one is on the list, and it's a good one to use. But you can also use sprays. This is a little one, a little to-go spray you can take with you places. But it needs to be sprayed on the area after it's been cleaned with soap and water, and then it needs to stay there.
All right, so clean your countertops with soap and water first, and then you come back and spray on.
Wipe on. If you're going to
disinfectant you have.
Right, it needs to be wet. It needs to be actually wet, and then you let it dry for as long as it takes. They say on this one package 4 minutes, but it could be longer than that.
And let me bring up a hand sanitizer. Okay, so I put it on, and I'm done.
No.
Okay.
No. And that's what I see people doing a lot. They just woo, and they're finished. And that's not what you need to do. You need to wash your hands, if at all possible, instead of using the hand sanitizer. Hand washing is best. Okay, soap and water, 20 seconds, all of that, like we've been hearing. And every surface between your fingers, this is often neglected. Your thumb is often neglected. Fingernails, you can rub in your palm like this with the soap and water, and then rinse it for 20 seconds. Hand sanitizer needs to be 20 seconds too. You need to be doing it all surfaces, all around your hand for 20 seconds.
And then you let dry?
And it needs to dry on its own.
Just don't wipe it off.
Don't wipe it off. And if you're only doing this, you're missing all the other places on your hand. So it's not really doing what it's supposed to do.
You mentioned as a nurse, your knowledge of viruses and what this virus in particular is like. Explain that to me.
This one, the problem with this one is it's kind of insidious in some ways, meaning people can have it and they don't know it. So one of the things about the stay-at-home order is you may have it and not realize it. And if you go out because you think you're fine, you're infecting other people. Right. And this one has a much easier way to infect people. It's much more easily infectious. And also it is the mortality rate is higher. So more people are going to die from it. And we're trying to protect those at risk. Even if you're doing well, you need to protect those at risk and not be out there. Thinking about other people, doing and following what the protocols are and what the mandates are, that's very, very important. You got to take it seriously.
Susan, thank you so much for your time. You be safe out there.
Thanks, you too.
From cleaning to coping with this pandemic, of course, it's tested all of us. It's also challenged our mental health. In a time when we could all benefit from a little therapy, we called on Leslie Todd of Baton Rouge, a licensed clinical social worker who offers advice as we adjust to these new life circumstances.
We've all been through very tough times before. I think all of us, we can remember Katrina, we can remember Gustav and Rita, we can remember 9/11. We can remember the Great Flood of 2016. So we're resilient, and what we need to remember is we have to try to assemble what facts we have and then make decisions for our own selves. And the facts that we do have and what seems to be working is the good hygiene protocols we're all supposed to follow, the hand washing and the social sequestering of ourselves. One of the things that gives anxious people some sense of mastery is to have some things they can do. What's hard is the things that we can do are kind of things that we are not supposed to do. In other words, we can't go see our friends, we can't go to work, we can't do that. But it is a sense of, I am doing this for the best, for the better good. We are at sea. I'm at home. You're at home. Like this is crazy. So we've lost the routines that make us feel safe. Even if we thought our lives were boring, we kind of miss it now. So,
at least we knew what to expect a little bit.
Right. And of course, there are children out of school. It's very hard for kids because they don't understand. The young ones have no idea. And so one of the things parents can do is to give an age-appropriate explanation to the kids about this illness out there that we're all working to beat. It's probably good to check in with the news, like Governor Edwards, when he speaks, just to see what's going on, catch that, and then get off it, and not stay online with all that sort of stuff, kind of avoid that. It's important to check in with your family. If you're having a bad day, you should be able to say that. Now, I will say that families that are not doing well or marriages that are not doing well, the cracks are going to show more. And so it's a time to be really gentle with each other when you can and really understand it's a time to pull together, which is, with the marital therapy I do, I've been really impressed that so many people are seeing that there's a greater good they need to work for right now. And they're kind of backing off some of their issues in order to get through this.
What would you leave us with right now, Leslie?
I guess stay strong. This too shall pass. It is good time to bond with your family. I think some children are getting more mommy and daddy time than they normally do, and that's okay. That's good. Yeah. We'll all see each other again, and we will learn from this. It's tough, and I grieve for the people who are losing their loved ones. But we're strong. We've been through things before, and we'll come out of this stronger.
Leslie Todd, thank you so much. It's always great to talk to you.
You too, Andre. Take care.
The routine of going to church or synagogue is on hold during this crisis. No big Passover or Easter celebrations this year, but Pastor Brady Witten of First United Methodist Church in Baton Rouge tells me to have heart. There is hope.
They always tell you in times of disaster, in times of disruption, that it's important to keep your normal rhythms and routines. And I certainly think our spiritual lives are a part of that. And one of the big disruptions we've experienced, I think all across the country, is the inability to gather in person for worship. For a lot of people, that's on Sundays. So I know that a lot of churches have been offering online worship opportunities on social media, and I really encourage people to take advantage of those as much as they can. You can do televised services, which are a little more traditional. We turn on our TVs, and then I know churches are also providing at-home resources. And so maybe if you know somebody who's not so technically savvy, maybe you can print out something for them that they can participate in some readings and prayers at home without necessarily accessing the internet. It seems old-fashioned, but telephones are technology at some point in time, and they're one of the ways we can stay in touch with people. We have several people who live in a retirement community in Baton Rouge that are members of our church who've been locked in, and they even for a time weren't able to send and receive mail. Pray with people over the phone. You talk about elderly folks, sometimes the memories of things they know from their childhood are really important to them. The Lord's Prayer is always a great one. And most people know that if they're Christian. And so I think anything that we can do to help bring a sense of connection and a sense of familiarity and connection between people and connection between God is really important at this time.
This is a high Holy Week, and we're getting ready for a big weekend ahead of us where we typically would be out together and celebrating, but that's not possible or smart right now.
Yeah, I certainly have been encouraging everybody to follow the guidelines of the public officials and our health officials. The message of Easter is a message of hope. It's the message that the worst thing is never the last thing. And I just know I need that this year, and I know probably a lot of other people do as well.
It's a great thing for us to hold on to. Brady, thanks so much for taking your time for us.
Yep. Thank you, Andre.
And everyone, that is our show for this week. Remember, you can watch anything LPB anytime with our LPB app.
Download it for free from your app store. This upgraded version features news, public affairs, documentaries, how-tos, and many more programs. And please follow us on Facebook, Twitter, and Instagram.
For all of us here at Louisiana Public Broadcasting, I'm Andre Morrow.
And I'm Natasha Williams. Thanks for watching.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.